Alors, la tâche, pour commencer, on va faire du lavage, okay? Comme si vous étiez à la maison chez vous.
I knew I wanted to go into a healthcare field because I love working with people.
Ouais, hein?
You have to be a people person.
Peut-être on l'a trop rempli.
The occupational therapist is always referred to as the most friendly member of the team, the most down-to-earth, easy to relate to. As occupational therapists, our main emphasis is on client-centeredness.
Tu vois, ça sonne aussi bien que si c'était un
So
accent aigu.
when you're intervening with a patient, all your objectives essentially are set with your patient. So you're always working towards the same goals.
Vous avancez pour éviter la roue.
One thing that they try to emphasize in the program is they try to get you to see as many different parts of the profession as possible, which was great for me because I didn't really know what area I wanted to specialize in. Now I'm here at Notre-Dame de la Merci in my final stage, and I'm really loving it.
When I entered the occupational therapy program, at first I was quite nervous because I had heard that there were some difficult courses in some science-based fields. By working in groups, by being in a small class, and by really having teachers that are there to support you, it just made the process a lot easier. In our different lab classes, we've experimented working with a lot of different creative media. So we've done a lot of projective artwork, whereby we explore the different psychological components of a person through painting and drawing. Right now we're studying the different components of entrepreneurship and management skills. We're doing a project in our class that's actually really a hands-on project where together we're collaboratively making a business plan. I really like the location of McGill University. We really do have a beautiful setting. I think throughout my studies as an occupational therapist, and I'm pretty sure for the rest of my classmates, we've been able to start to identify which areas we'd like to work in just because we see so many of the different areas in our studies. I'll be graduating in a few months, and it's great to see that there's so much opportunities out there for OTs, and really there's opportunity in any possible field that can interest you.
Stroke is a very common condition that we see as occupational therapists. There are more than 50,000 people in Canada every year that experience a stroke. And why it's so interesting for us to treat as a condition is that these people are often left with paralysis both in the leg, the arm. They might also have problems in how they perceive the environment and how they see, and also in how they can speak and communicate. So stroke rehab is really interesting in that you work in a team. So it's not just the occupational therapist, it's the physical therapist, it might be dietitians, speech-language pathologists, and together you focus on the patient and the family. And you could imagine also for a family who one day dad is perfectly fine and going off to work driving a car, and the next day he's in bed paralyzed, having a hard time saying your name. You really need a team approach. And I think the nice thing is being an occupational therapist, you really can help the family understand how to help the patient, and you can help the patient. You can encourage them that even if you're using one arm right now, you can do everything. You can dress yourself and you can get back to work, and we're going to work with you to get all those things in your life happening again. And if you love to golf, we'll get you golfing again with one hand, and we'll figure out the way the golf cart can drive around with one hand. And you know, I think it's the whole participation in life that we focus on, and that's what's so rich about the profession.
One of the most rewarding aspects of my work is having the opportunity to begin to intervene in a group of babies whose life is just beginning. I'm an occupational therapist, and I graduated from McGill University in 1992 with a bachelor's in OT. having training that enables us to provide developmental interventions in a global, holistic manner really sets us aside and provides us with a very unique role for the neonatal intensive care unit. I still provide teaching for the residents and fellows in nursing on brain injury. I was able to establish a pediatric neuroimaging research program at the Montreal Children's Hospital where graduate students and trainees have the opportunity to perform high-level post-processing.
Donc ici, Nicolas, ce que je voudrais faire, c'est de regarder si les malformations au cervelet ont un effet sur...
Occupational therapy continues to be an evolving field, and it really would best be represented by individuals who thrive on creativity, who believe in pushing the envelope and in continuing to take an evolving field to the next level.
I was diagnosed with rheumatoid arthritis when I was 1.5 years old, and so I basically went through a lot of surgeries, hips replacements and knee replacement surgeries. It's pretty much attacked all my joints in my body, so I'm having trouble moving. I see my occupational therapist once a year for a general assessment of my needs and what I still need to improve. When I was young, my occupational therapist built this little bench to help me put on my socks, and now I use it to transfer myself into the bath. Another thing that the occupational therapist built, I have this brace that I use to rest my wrist when I'm typing on a computer, and I have this rubber thing that I use to open jars, and I also use it I put it underneath my plate so that when I'm eating and cutting, it doesn't move. Yeah, it's basically a universal handle, and I use it to open switches. I use it for the stove, and you press it and you turn it to turn on the stove and lights and everything. My occupational therapist usually writes letters to explain if I need services from school or the government. They usually explain my limitations and my illness and what I can and cannot do and the services that I need. And so I can definitely live independently because of the services that I get from my occupational therapist and from CLC. Yeah.
Puis vous allez suivre mon crayon quand je le bouge, seulement avec vos yeux. Je suis quelqu'un qui aime avoir des résultats rapides et ça, je le retrouve beaucoup dans mon travail. Très bien. Mon travail consiste à faire l'évaluation de la conduite automobile chez des personnes qui ont eu un accident ou une déficience physique. Si je veux évaluer la sécurité d'une personne à conduire un véhicule, je vais aller sur la route avec cette personne-là et la mettre en activité réelle, en situation réelle.
Ça ne demande pas beaucoup d'efforts pour mettre une flasheur.
Ça prend une personne qui aime être en contact avec les autres et qui aime l'aspect de la relation d'aide.
Et la même chose.
Ça prend aussi quelqu'un qui aime avoir un esprit scientifique ou qui a une attraction pour les sciences médicales. J'ai été fasciné de découvrir qu'avec un seul type d'emploi, il y a plusieurs portes qui peuvent s'ouvrir pour les ergothérapeutes. À quelle fréquence environ vous conduisez, M. Dussault? Dans mon cas, tout ce que je touche, c'est l'aspect des transports, donc la conduite automobile. Donc, c'est très, très spécifique. Maintenant, pouvez-vous me dire... J'aime beaucoup avoir ce sentiment-là, d'être un certain expert dans un domaine très précis.
I had a position where I was half-time in the technical aids department and half-time in the assistive technology department. The technical aids is providing wheelchairs and seating or special positioning to people with physical disabilities. And assistive technology is looking at things like giving them access to the computer, to be able to control their environment, or it's also called electronic aids to daily living, so that somebody who's severely disabled can still turn off the lights, control their television, control their sound system, etc. One day, one of my colleagues asked me if I could come by to consult because there was somebody who wanted to go sailing who had a lot of postural problems, and she would really appreciate my expertise to figure out how to position this person in the sailboat. So I said, well, okay, but just an hour. I don't have more than an hour. And I got out there, and just being in the yacht club milieu again, I was quite happy, and then, found solutions for this person so that he could go sailing. We got out on his boat, and when he found out that I knew how to sail, he sort of said, well, here, then you sail. And he gave me the tiller, and that was it. It's just a fusion of my two loves, OT and sailing. So it's a very logical passion for me. The Mobility Cup is Canada's international regatta for sailors with disabilities. This year we had 42 sailors from across Canada and the US, as well as England and New Zealand, who came in for a week of racing. It ranged from people, for example, with multiple sclerosis who are having balance problems and walking with a cane, at the low end of the spectrum, and at the high end we had somebody who was quadriplegic, totally paralyzed, arms and legs. He was able to sail independently by sipping and puffing on 2 straws. And when we hold these events, a big part of it is getting the people in and out of the boats. We use a sling and hoist system with them, but it can take 3 or even 4 people to get the person transferred out of their wheelchair into the boat, and then do all their special seating setup. I recruited OT and physio students from McGill to come and help us.
We've got a boat coming in right now. Do you want to put them here?
It works well for everybody because they're acquiring some clinical knowledge, but they have some background as well. It's a lot easier to train them than it is somebody just who would come in off the street who knows nothing about physical disabilities. All of us working with people with disabilities are interested in social integration, self-esteem, and that's definitely what the sailing is all about. They're coming to a regular yacht club. They're interacting with other members of the yacht club. They're meeting other people with disabilities who are part of the program. There's the social activities, but there's also the self-esteem and the sense of accomplishment that in spite of their level of disability, they're still able to sail a boat entirely on their own.
What I do in this room is I run an engagement group, which means that it's basically a reaching out, that you can come in and you can be whoever you are with whatever way you want to be, and that's okay, and we will do artwork together. Something creative, paint, something regressive and cathartic like clay. How can you match something that can be healing to a person? It's a way for them to connect, because no matter how ill you are or how paranoid you are, we all need to connect. I get to see different parts of their personality and emotions through their artwork. So it's an indirect way to talk about things using projective techniques. Occupational therapy is the proof that the imagination can heal someone. Because you have to be so creative to imagine how difficult the day-to-day of a person is, to imagine how one activity or series of activities can help someone, and to imagine how you can step into someone's life in a respectful way and bring them something. We're taught from day one to see the person as a person and not as a list of problems and illnesses. I think that's really cool.